Hi, I'm Suzanne Gordon, and I am a senior policy analyst for the Veterans Healthcare Policy Institute and a journalist and healthcare researcher who's written a lot about private sector care and care delivered by the Veterans Health Administration. And I'm very happy to be here today to talk to all of you. And I'm with Bruce Carruthers, who's going to be speaking after me. And Bruce is a veteran who, and he will introduce himself, but he's a veteran who uses VA care, and he's also worked for the VA and for private hospitals, and has a pretty good understanding, both as a patient and someone who's worked in the Veterans Health Administration, about what an important system it is. So Bruce will be talking to you after I finish my remarks. I want to begin my remarks by asking you a question. And if we were together in the same room, I would ask folks to raise their hand, but we can't do that. So I'm just going to ask you to think about this. And I'm going to ask you actually three questions. The first is, how many of you who are healthcare reform advocates, when you think about the Veterans Healthcare System, the Veterans Health Administration, how many of you think of it as a model of high quality, affordable healthcare that should be discussed when advocating for genuine healthcare reform in the form of Medicare for all? So that's question number one. Question number two is, when you are advocating for healthcare for all and for Medicare for all, how many of you think of the 19 million US military veterans and their families and communities, and that their families conservatively estimated adds about another 40 or 50 million folks to the mix? How many of you think that veterans, their families, and communities would benefit directly from Medicare for all, and should be specifically approached and considered a valuable partner in the struggle for genuine healthcare reform in America? That's question number two. And question number three is, how many of you who are active in promoting Medicare for all are also concerned about or active in the struggle to prevent the privatization of the veterans healthcare system, and really view the efforts to privatize VA care as parallel to those efforts to privatize Medicare through Medicare Advantage plans or direct contracting entities? So obviously, if we were together, I could see hands raised. So I'm going to hope that everybody said yes, yes, and yes to all those questions, and that if you don't think yes, yes, and yes now, you will by the end of the talk that Bruce and I are so happy to be presenting today. I want to look at kind of each issue in turn. And I want to take the first issue. I've been writing about healthcare reform for decades, and I have to say, as someone who isn't a veteran and until about 15 years ago didn't know that many military veterans, I really didn't know enough about the veterans healthcare system. I mean, like all of us, I when driving down the highway or in an area, I would see the signs, VA hospital, turn here, but I didn't really know enough about what went on in those VA hospitals. And that's pretty interesting. And I think it probably parallels the experience of many of you, that very often we don't know what is going on in the largest healthcare system in the country, the nation's only socialized medicine system and single, really, it's sort of multi-payer, but let's say single payer healthcare system. I think that, like many of you, I knew more about Canada or France or the Netherlands or Scandinavia or even Taiwan and Switzerland than I knew about the healthcare system around the corner or across the street. And That was remedied when I began writing a book called Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation's Veterans, and spent years going around the country and looking at VA hospitals and interviewing veterans and caregivers in the Veterans Health Administration. The Veterans Health Administration, in case you aren't familiar with this, is the largest agency of the three in the Department of Veterans Affairs, has about 9 million patients, most of them sick, poor, and old, because you can't get eligibility to VA care unless you have a low income, service-connected disability, and a service-connected disability. And so that means that the VA cherry picks really the sickest, oldest, and poorest patients in the country, and some of the most complex, and it delivers care to them in a much more cost-effective way than the private sector does to those of us who aren't veterans. One recent study showed that veterans who were seen in private sector emergency rooms compared to seen in VA emergency rooms had a 20% increased chance of dying, and the cost was 21% higher for that, for the treatment that they got. But the VA has not only a publicly funded system, but it's fully integrated and coordinated, and it doesn't deliver the kind of care fragmentation that is so epidemic in the rest of the healthcare system. And all VA employees, physicians, nurses, all kinds of health professionals and other employees are on salary, so there's no incentive to overtreat. And the VA really has an amazing model of care, and serves not only veterans, but all of us. The VA doesn't just deliver clinical care to veterans, that's its first mission. And the clinical care that it does deliver is really quite extraordinary. I wish I could be a VA patient sometimes. They practically invented geriatric care. They have amazing end-of-life and palliative care. Their primary care integrates primary care and mental health care. They have pharmacists on primary care units and dietitians. It's pretty extraordinary in that if a VA patient says I'm anxious or depressed, they don't write a referral to a mental health provider who the patient may or may not go and see, making an appointment that they may or may not go to. They actually walk them down the hall to a psychiatric nurse practitioner, psychologist in a warm handoff. And it's a very important model of care that was pioneered in the VA, and it's very hard to reproduce in the private sector. The VA also is one of the only systems that really tries to deal with healthcare equity. In the recent COVID-19 pandemic, a study demonstrated that the VA didn't have disparities in deaths from COVID-19 as was true in the private sector. The VA also, and most people don't know anything about this, teaches many healthcare professionals in the United States, 70% of American physicians in trainings, psychologists, nurses, all kinds of other health professionals. It really is at the hub of the healthcare training system in the US. And also the VA is one of the largest research powerhouses in the country, because think about it, they have veterans, a stable population of veterans from discharge to grave, so they can collect amazing big data. They have I always thank the VA for my first shingles vaccine because they helped develop it. If I used a nicotine patch, I would thank them for that. They're currently conducting a Million Veteran program, which is developing the largest genome genetic database in the world. And this research is not proprietary, it's available to everyone, everywhere. And then finally, the VA has a fourth mission, which is even less known than the first three, and that is to serve as a backup to the non-VA healthcare system in a time of emergency, which it did in the COVID-19 pandemic. VA physicians and healthcare professionals went to many hotspots and helped out. They took over nursing homes. They opened their wards to civilian sector patients from hospitals that were overwhelmed and so forth. I think that it's really important to understand, that when we're advocating for Medicare for all, and particularly fighting this idea that the government should have no involvement in healthcare, that we be able to point to the amazing success of the VA as not only a payer but a provider of healthcare services. And that's why the VA is so important and is so innovative, because it is both a payer and a provider of those services. And it's very important, I think, for folks to know about the VA, because if we don't understand the positive model of VA healthcare, it's very hard to rebut right-wing attacks on the VA, which are a stable of those like the Pacific Research Institute and its executive director, Sally Pipes, who's constantly using the VA as an example of a sort of poster child, along with the British National Health Service, of why you don't want any government involvement in healthcare. So there's really overwhelming positive reasons for us to talk about VA care. And there's a real imperative to understand VA care, because you need to rebut these negative arguments. I want to move on to the second question, which is, do you think veterans would benefit from Medicare for all, and should they be approached as a constituency to advocate for genuine healthcare reform? And the answer to that is just absolutely an overwhelming yes. As I said, there's 19 million veterans in this country. Only 9 million are eligible for VA care because of some pretty ridiculous eligibility restrictions imposed by Congress. And that's because nobody has ever been willing to pay for the true costs of war and military service. And so that means that there's something like 11 million veterans who can't access VA care, and many of their families and communities are either uninsured or underinsured, or suffer from the broad problems of American healthcare and the constant American healthcare crisis. So they are really, really a group that would enormously benefit from Medicare for all if it were enacted and correctly implemented. And so they really need to be talked to about this issue, because many of them are unfamiliar with how the VA works, and also they are very subject to right-wing propaganda that attacks Medicare for all. And so if we don't give them our arguments, you can bet that the right wing is going to try to organize them to be against genuine healthcare reform that would benefit them and their communities. Another way that veterans would benefit from Medicare for all is that Medicare for all proposals would really, if enacted, eliminate the fundamental mechanism that right-wing ideologues and healthcare industry and pharmaceutical industry interests are using to fight to privatize the VA. The VA is currently, and I'm going to deal with this in just a minute in my concluding section. The VA is currently under attack by right-wing privatizers, hospital industry privatizers, who want to get a hold of this $80 to $90 billion pot of gold that is going to public provision of care rather than to private sector profiteering. And the way they are doing this is by telling veterans that they, should be able to have choice of private sector providers and VA providers, and they're stealing the money to pay private sector providers from the VA budget. Since 2014, about 20% of the VA healthcare budget is now being used to pay for lower quality, higher cost private sector care. In spite of the fact that it's documented that VA care is most often superior to that provided by the private sector. Well, if veterans had, through Medicare for All, choice of any provider they wanted to, and it was paid for, by Medicare for All, then you wouldn't have to be poaching and cannibalizing the VA budget to provide care to veterans. So that's another important reason why veterans would benefit from Medicare for All, because it would stop the privatization of the Veterans Health Administration pretty much in its tracks. And, veterans are a tremendous asset in any struggle for reform, because even though they are an increasingly small minority of the population due to our all-volunteer Army and the elimination of the draft, veterans have an enormous moral sway, particularly in communities in which are usually not that welcoming to liberals and progressives. So, having a group of veterans for Medicare for All and improved Medicare and so forth really is enormously important. And there are many groups like the Save Our VA campaign that Bruce Carruthers in Veterans for Peace is involved in common defense. There are many veterans groups that would be certainly and are active in this struggle. And even some of the traditional veteran service organizations might be persuaded, if they were approached in the right way, to at least consider these efforts. And once again, if we don't organize veterans, the right wing is going to do it. And they're already doing it. I mean, Trump's VA secretary, Robert Wilkie, put out an op-ed and a press release against Medicare for All, arguing that it would dismantle the VA, which is pretty ironic since that was his agenda, dismantling the VA. Darren Selnick, who is a representative of the Koch brothers funded Concerned Veterans for America, has attacked Medicare for All. So again, it's very important for us to counter these arguments and get people on our side. And so I think that the final issue that I want to address is that we really need, as those fighting for healthcare reform, to maintain the integrity and improve and strengthen the VA as an example of a government-run program that works. It is a government-run program that works. If it didn't work, the Koch brothers wouldn't have to be spending, or the Koch, now the Koch brother, wouldn't have to be spending millions of dollars each year to attack it, because, it would just fall over because of its own problems. And the reason why they spend so much money attacking it and bashing it and trying to convince everyone from the New York Times and NPR to claim that the VA is broken beyond repair is that it is in fact an effective healthcare system. And but it is being attacked by privatizers. In 2014, they passed the Choice Act. Bernie Sanders championed that act because he thought it was going to be a way to get more money to hire staff in the VA. And he worked with John McCain to pass the Choice Act, which gave veterans some ability to seek private sector care. Bernie was assured that this would be a temporary measure. He had previously presented legislation, some of the most important legislation in years, that would have strengthened the VA enormously, but Republicans defeated it. John McCain then turned around and said, I was lying, and they made choice permanent in the Trump-initiated Veterans the VA Mission Act of 2018, which dramatically accelerated VA outsourcing of VA care to the private sector. And the Mission Act included a kind of base closing section, which is called the Air Asset and Infrastructure Review Commission, which has assembled a commission which has just been appointed by the Biden administration. And it's a 9-member commission that's supposed to look at what VA facilities to improve and which to close. And tragically, Biden's secretary has recommended closing massive amounts of closures, some rebuilding, which is extremely unlikely because Congress is unlikely to fund it. And tragically, the administration, I think, is doing a lot, doing to the VA what it has done to Medicare with its direct contracting entities. So people really need to join this struggle to save the VA and to really fight for veterans, no matter what you think of American military or the wars that we have been involved in. Veterans are a group of people who have sacrificed themselves and sometimes their lives and certainly their health. And we owe them quite a bit. And we also owe it to ourselves to maintain and strengthen and expand a healthcare system that really helps us all. And I want to give this over now to Bruce Carruthers, who's going to talk to you about his own experience, both as an employee and as a patient at the VA.
Thanks, Suzanne, and thanks for inviting me to participate in this important effort. I thought first I would give you a little background, and then I'll talk about my experience in the VA and why I think the VA can be an important part of Medicare for all. I'm a Vietnam veteran. I was also a career VA employee. I worked at 10 facilities in my career, including 2 psychiatric facilities, American Lake in Washington State, Canandaigua in New York, 2 smaller community type facilities like the Erie, Pennsylvania VA and the Wilkes-Barre VAMC, VA Medical Center, and in highly affiliated medical centers, that is affiliated with medical schools, Birmingham, Lexington, and Denver. I also did a 3-year stint in central office in Washington, D.C., where my job was to be a liaison between hospitals in the Southeast region, central office officials, and congressional staff. So at the end of a 30-year career, I had a pretty good understanding of how the VA works. I spent half my career in human resources and the other half in hospital administration. I'm a member of the Veterans for Peace Save Our VA Steering Committee, where I have the privilege to work with Suzanne on a regular basis. And I do receive my health care at the VA Medical Center in Asheville, North Carolina. So I say that to try to establish that I'm pretty familiar with the VA. The first issue I'd like to address is why should the VA be maintained and strengthened? As Suzanne mentioned, there's an attack upon the VA and people are asking why should we maintain this public health care system for veterans? There are a lot of reasons for it. One of the main reasons is that a lot of people don't appreciate now because less than 1% of Americans serve in the military. Veterans have very specific medical and psychological issues that are not easily addressed in the private sector. Just to give you an example, many post 9/11 veterans have had 3, 4, 5, and sometimes 6 tours in Afghanistan and Iraq and in other areas where they're in danger. They suffer physical and mental issues from these. Traumatic brain injuries, exposure to toxic burn pits, PTSD problems with drug abuse that are not easily handled in the private sector. So just to cite one example, if I'm a combat veteran and I'm experiencing PTSD from that, it's very unlikely that if I'm put into a group with people who've not had the same experience that I'll talk about it, and the people who are treating me won't have a full understanding of what I've gone through, But VA psychiatrists, psychologists, social workers, all have been trained in this and have experienced it and they understand it. And I'll give you a personal example. I have a service connection, a cardiac service connection from exposure to Agent Orange. If I see a private cardiologist, he won't know to ask me if I'm a Vietnam veteran. And if I am, and I have a cardiac condition that may well be due to exposure to Agent Orange, and I'd be entitled to service-connected compensation and health care as a result of it. There's also a great benefit to the nation, as Suzanne mentioned, so I won't go over it too much. The VA is one of the primary trainers of healthcare personnel in the United States, not just physicians, nurses, social workers, all kinds of technicians. The VA has training agreements with educational institutions all over the country and trains many healthcare providers. The VA is nonprofit, as Suzanne mentioned, so there's no need to fill capacity. And I will just give you a quick personal example. My mother-in-law had terminal cancer, and the place where she was being treated wanted to refer for chemotherapy. We got the records and showed it to the head of oncology at the VA in Denver. And he said, there's no need for her to have chemotherapy. All this is going to do is make her feel worse. It won't delay her death or make her feel any better. They're just trying to fill capacity. And in fact, he got in a pretty vigorous argument with the facility. He actually called them to tell them he thought it was unnecessary. The point is, this facility had capacity to fill, so it had to have patients. The VA is not in that position. It doesn't have to have fill its capacity. And then last, as Suzanne mentioned, there are numerous studies, study after study, that show VA care is equal to and generally superior to the private sector and cost effective. And these are not studies by the VA. These are studies by independent medical groups or published in medical journals, studies by the RAND Corporation. Next, I wanted to talk a little bit about some personal examples of how the VA has helped people that I don't think they could get help in the private sector. One of my colleagues from Chicago, who I've worked with in Veterans for Peace, went to West Point, was an infantry officer in Vietnam, had severe PTSD when he left, and for a period of time, he was a drug abuser and he was homeless. Finally went to the VA. He got his life turned around. Now he's married and very successful. And he'll tell you, if you talk to him as anybody, that the reason he's alive today is because he went to the VA and the VA helped him. I have two friends from home who were in Vietnam at the same time I was, who were both in the infantry, and they went through extremely difficult times upon their return. In the early 80s, they began seeking care in the VA, partly at my urging, but not entirely. Both of them are very successful now. They have families, they've had successful careers, and if you talk to them, they would also credit the VA for turning their lives around and maybe saving their lives. And in my career, in the some 30 years I worked for the VA in all those facilities, I met countless veterans who thanked the VA for saving their lives, and veterans' families who thank the VA for what they've done for the family and what they've done for veterans. Because as Suzanne mentioned, the VA has a holistic approach to healthcare. You don't walk in the door and see a specialist about one thing. You see a primary care provider who refers you to a specialist. You go back to that primary care provider, you meet a treatment team. So if you have several conditions, there's a team that treats you and you're part of a family. It's not like it is in the private sector where it's disjointed, where you have to get a referral, you have to transfer your own medical records. You're part of a system that takes care of you, takes care of the whole person, your medical needs, your spiritual needs, and your psychological needs. How could the VA be part of Medicare for all? I've had people ask that question. Suzanne mentioned the VA as a model, and I have to tell you personally, I think if most American citizens understood the kind of care veterans receive at the VA, they would say, how come I don't get that kind of care? Why am I not entitled to this holistic care? Why do I have to seek out specialists? Why are things so disjointed? Why can't I have all my care taken care of in one place? Well, what the VA could be under Medicare is the provider of choice for veterans and veterans' families. And in fact, if the VA could get reimbursement for that, it could be funded by Medicare. The VA's costs are substantially less. In fact, the VA had an experiment at the Tuskegee Medical Center some decades ago where it took in veterans, any veteran who wanted to have Medicare, and it only billed what Medicare would pay. There were no copays, no deductibles. And that VA facility actually made money on that. So the VA could be a provider for veterans and for families. And Suzanne didn't mention this in particular, but 9 million veterans are treated by the VA, but there are whole categories of veterans who could be treated. That is, any veteran could get service there who's eligible for Medicare. There are a lot of veterans who have what are called bad paper discharges. Those are less than honorable discharges, and they're eliminated from care in the VA. The law only requires that a discharge be other than dishonorable. The VA has constructed a very complex system, regulatory system, to determine whether somebody gets care or not. If the law was changed, that would open up care to hundreds of thousands of veterans. And if we opened up care to veterans' families, because often a problem a veteran has, it's not limited to what the veterans experience. It affects the whole family. A veteran with PTSD, a veteran with severe disabilities who requires care, it's a family event. And if the VA could be open to the family as a part of Medicare for all, it could be a provider of choice for veterans and for veterans' families. The last point on why we should maintain the VA, I think, is the federal government over the years has made an incredible investment in the VA, in its education mission, in its research mission, its care mission, and its mission of national preparedness. It would be a shame to dismantle that and have it go to the private sector, which can't provide the same level of research, can't provide the same educational opportunities, and certainly cannot serve as a backup in national preparedness. So there are many reasons to preserve the VA, and it can be a part of Medicare for all. And in my opinion, it should be a model for medical care in this country, not just for veterans, but for everybody. And if more people had exposure to the VA, I think they would see that this is the kind of health care that all of us need, a holistic, integrated approach to health care that focuses on preventative medicine and treating you for a whole lifetime. You don't go from one insurance company to another, from one provider to another. Your medical records are available to everybody in the VA, and you can be part of a research project. It really is a model for healthcare in this country. So I think there are many reasons to preserve the VA, and I think the VA could be an integral and a beneficial part of any Medicare for All program. I agree with Suzanne, we should be trying to encourage veterans to support this.
I think that Bruce made such important points, and I think that the idea of expanding the VA, particularly in rural areas, because right now there's an effort to close down so-called underutilized VAs. And if we had Medicare for all, we could open those facilities to veterans' families, to veterans who have too high income, bad papers, et cetera, and even community members. And that would go a long way to helping solve the rural healthcare crisis, as opposed to what the Biden administration is proposing, which will exacerbate it. We could talk to you all day and all night, but you have a lot of other things to listen to, and we're very grateful to those who are listening to this presentation. If you want more information about these issues, you can go to my website, which is suzannegordon.com, or the website of the Veterans Healthcare Policy Institute, which is veteranspolicy.org. And Bruce, would you tell folks about how they can get information about the SOVA campaign, the Save Our VA campaign?
Yes, you can go to Veterans for Peace /Save Our VA, or if you just put Save Our VA in a search engine, it should show up. And if you go on there, you'll see our webpage, you will see what we're doing, how you can get involved, our calls to action that we send to various congressional delegations and administrative officials on issues we think are important. We'd welcome anybody to join us. You don't have to be a veteran. You just have to be interested in veterans health care. Everybody says thank you for your service. And I often say, well, I appreciate, but if you really want to thank me for my service, support the VA healthcare system. But it's been a pleasure, and I sure appreciate the opportunity to have to talk to you. And I got to say, it's a real privilege to be able to work with Suzanne. She's part of our steering committee and an invaluable member.
Thank you. Thank you so much. Take care.
All right, bye now.